Bringing you the news and information you need from the people making a difference. This is Comcast Newsmakers.
Welcome to Comcast Newsmakers. I'm Ken Ackerman. We are at the campus of Washington State University in Vancouver. Back in 1996 it was built, and they're still building more buildings. They want to become a university of 20,000 students by the year 2025. Joining us on Comcast Newsmakers is John Wiesman, who's the Director of Clark County Public Health. Thanks for being with us.
You're welcome.
When people think of public health, they don't really wrap their heads around it. Give us on layman's terms what it is.
Great, I will. One of the things I like being in public health is that it touches everybody's life every day. For example, when you get a drink of water out of your tap, public health has been there protecting that water, either through testing water or regulating septic systems to keep the water safe. When you go to a restaurant, we've trained the food workers in safe food handling and preparation practices. Or if you go to the fair, for example, we've been working with a fair on petting zoos and having appropriate hand washing facilities so kids don't get sick from E. coli. First-time mothers, for example, we help them be successful in breastfeeding and getting nutrition for their children and getting immunizations for their children.
It's a lot of branches people wouldn't even think
Absolutely.
of. And in Clark County, the residents here could feel fortunate because you also serve on the National Board of Public Health. So you go around the country, you see policies, programs that are being instituted in other states, and you really bring the best of the best back here.
Exactly. That's one of the benefits of participating at the national level.
Talk to me about some of the unique programs that are innate to just this area.
Well, one of the programs we've been doing is a pilot program, a home gardening program, with our parents who get home visiting nursing services. We partner with WSU Vancouver Extension Program in terms of the Master Gardeners. We partner with the Friends of the Carpenter, which is a nonprofit that works with homeless folks on woodworking. And what they do is they come together and help families build gardens on their property, whether it's a rental property or a home they own, maybe 8 feet by 10 feet. And they grow vegetables and fruits all summer long. And so it's a great way to get healthy food into homes that folks might be low income, not be able to purchase those necessarily, or not have a grocery store nearby where they could actually get those. So it's a great partnership with the community.
Here's the bad part. You're facing budget challenges, and most people are in this economic environment.
Right. Public health services in this state really are in danger, and it's really actually not due to the economy per se. This has been a problem 10 years in the making. We've not received increases in our core funding from the state, and many of us from our local counties, in 10 years. And I think everybody knows you can't buy in 2008 what you were living on in 1999. So that's a real challenge. We've got women and infant children programs are at risk in terms of nutrition, family planning services are at risk. And so we're really concerned about teen pregnancy rates going up. They've been on the decline, so we're concerned about that being reversed. Immunization rates decreasing instead of increasing would be our concern. And infants born with low birth weight and dying in the first year. I think those are all real risks that we've got with this funding problem we have.
Now that we know the challenges and the risks, going forward, what is the plan?
The plan going forward for us here in local public health in Clark County is to see if we can transition any of those programs into the community. Because we know that the programs we have right now, this community cannot afford to lose. So that's going to be our first attempt. We're asking for $1.7 million in one-time funding from the county to give us a year to transition those programs. If we don't get that funding, then we're going to be at a place where we really need to cut programs come January.
On the national board, do you see this happening all over?
Yes, public health is struggling all across the country. I mean, I think truthfully, we have 2 wars we're fighting, and all across the federal budgets, you see that impact. The Centers for Disease Control's budget is being decreased, and a lot of that funding comes into local communities.
Well, John, thank you very much. We appreciate you coming here to the campus. As you can see, it's gorgeous site. And thanks for giving us a little insight into something that people see, but they don't really know what you do.
Right,
we appreciate that.
Me, Ken.
And thank you very much for being here on Comcast Newsmakers. For the crew here, I'm Ken Ackerman. Make it a great day.